Alright, hey guys, this is going to be the video covering muscles 51 through 60, and then I will be coming back with the final video going over muscles 61 through 70. So, to start with our muscles here, the first muscle we're going to look at is actually a muscle closer up to the hip. And this muscle is going to be called the iliopsoas. And so this muscle is actually a little different because the iliopsoas is actually technically two different muscles. So if we come here, and I'll just go ahead and quickly spell out the muscle. So we have an iliopsoas. We have sort of an ilio part and we have a psoas part. So if we think back to our bone anatomy, we have what's called the ilium of the coxal bone, which is that region of the coxal bone. And if we remember, right around here would probably be about where our iliac crest is. Well, there's that iliac fossa. And inside that iliac fossa, we have a muscle that sits in there. And that muscle that sits in that fossa is going to be the ilio portion of the iliopsoas. And so if I kind of highlight in here, this right here would be the ilio part of the iliopsoas. Now you say, okay, where's the psoas part? So that is actually going to be right here, and I'll get a smaller size here. So this muscle right here is going to be the psoas part on this model of the iliopsoas. And so on this model here, we can see the ilio part, we can see the psoas part, and together we give them the name the iliopsoas. And a lot of times you'll hear this muscle referred to as the psoas major even. And so it's just one of those ones where it's technically two different muscles that have kind of just been clumped together. And so for the sake of this course, we just need to refer to it as the iliopsoas, and that's about all we'll say about that. And so one last thing before we move on, if we look to the left here, we'll see there's this muscle right here, and this muscle is just a zoomed in view there of that psoas portion of the iliopsoas. So we would just call all that the iliopsoas right there. So now I'm going to go ahead and erase all this so we can look at our next muscle here. And that muscle, we can actually see it really well here, called our sartorius. And so our sartorius right here is going to be this long, and let me make the pen a little thicker here. So this long sort of spindly, twisted looking muscle is going to be what's called our sartorius muscle. And so just bear with me while I highlight it here. But this long muscle here is our sartorius muscle. And if we sort of move over here to the left, we can see it right here as well. So all right there is our sartorius muscle. So we had our iliopsoas, and now we have just identified our sartorius. So now I know next on the list is the adductor longus, but I actually don't want to cover that. I actually want to skip ahead a little bit because I think it's a little helpful. So if I go ahead and erase the sartorius here, the muscle I want to concern us with is actually the gracilis. So if we look at the medial thigh here, so this is a medial view of the thigh. If we look here, what we see is there's this nice band of muscle right here. And this band of muscle is given the name the gracilis. And so the gracilis is actually, I feel, a useful muscle to identify first because it's a helpful landmark to help us identify other muscles. And so just me highlighting some of these fibers here of the gracilis poorly. But so that's our gracilis muscle that I very poorly highlighted. And if we come over here and look, if we look anterior to the gracilis, this is the medial thigh, but we're looking anterior to the gracilis, what we'll see is this muscle right here. And this muscle belly right here that we're looking at, we give it the name the adductor longus. So we've got gracilis, and then sort of anterior to the gracilis, we have our adductor longus. I'll go ahead and spell that out right here. Adductor longus. And what it does is kind of in the name, it's going to adduct the leg there. So it's going to be an adductor for our leg. And so we have our adductor longus, we have the gracilis there in blue, and then in black, and unfortunately this is just the best image I have of it, I couldn't really get a better image, but black is what I'm going to be highlighting for our adductor magnus, and it's this muscle back here. And so if we kind of quickly highlight that there, we've got the adductor magnus, and we'll notice that it's posterior to the gracilis. So the reason we want to kind of use the gracilis as a little bit of a landmark there, because the gracilis is relatively easy to identify. We find the gracilis, the muscle belly that is anterior to the gracilis is our adductor longus, and then the muscle belly that's posterior to the gracilis is our adductor magnus. I'll go ahead and spell that out too. So adductor magnus. So again, adductor magnus in black, adductor longus in green. Magnus is posterior, longus is anterior. They're all on the medial aspect there of the thigh, and then sort of medial, intermediate to both of those is our gracilis muscle. All right, so that is our adductors, and now if we sort of shift our focus to the quadriceps muscle. So quadriceps is kind of, we usually just refer to it as a quads, but it's actually not one muscle. It's 4 muscles, as I'm sure we're all aware. So the quadriceps, quad means 4, ceps means head, so it's 4 muscles or 4 heads. And so the first main sort of muscle we focus on with the quadriceps is going to be this muscle right here, and this muscle we give the name the rectus femoris. Rectus because it extends the knee, and femoris because it's on the femur, and this muscle right here is our rectus femoris. And so this is the sort of main muscle here that we can easily identify on the quadriceps. But there's still 3 more muscles that we need to concern ourselves with that sort of form that whole group there. So we have 2 muscles. First of all, remember this is an anterior view of the thigh here. So we're looking anteriorly. And we have 2 muscles. We have the vastus medialis and the vastus lateralis. So if we look here, what we'll notice is we have a muscle belly right here, and I'll highlight this in blue. We have a muscle belly right there, and we have a muscle belly right there, and one of these is medial to the rectus femoris, and one of them is lateral. So we're going to give the medial one the name vastus medialis, and if I just go ahead and highlight that right here, we have our vastus medialis right here. And then we have another muscle there that is going to be lateral to the rectus femoris, so we give this muscle the name vastus lateralis. And let me just go ahead and quickly highlight this right here. And so again, we've got that muscle in the middle there. We're looking at this sort of superficial anterior thigh there. We've got that muscle in the middle called the rectus femoris. The muscle belly that is on the medial side, we give it the name the vastus medialis, and then the muscle belly that's on the lateral side, we give it the name vastus lateralis. That's 3 muscles of our quadriceps, which we know is 4 muscles. So the final muscle is actually going to be deep to the rectus femoris. So if we look at this view right here, what we've essentially done is we've taken and reflected back or removed that that rectus femoris. And so what we're seeing is we're seeing up underneath here, actually if we just go ahead and quickly identify, we've got the vastus medialis right here. Okay, we've got that vastus medialis. We have the vastus lateralis right here. And I'm just quickly highlighting these. So we've got our vastus lateralis in blue, vastus medialis in yellow, and then right there, sort of wedged in the middle, the intermediate muscle that's deep to the rectus femoris. Remember, this is deep to the rectus femoris, or the rectus femoris is superficial to this muscle. This muscle is called our vastus intermedius, and so I will highlight this muscle in green here. So this is going to be our vastus intermedius muscle, and this is going to form the final muscle there of the quadriceps group here. So for our quadriceps, we have the rectus femoris, which is that anterior superficial muscle. Then medial to that, we have the vastus medialis in yellow. Lateral to that, we have the vastus lateralis in blue. And then deep to the rectus femoris, we have the vastus intermedius here in green. And so the final muscle for this video we're going to sort of cover is going to be actually on the lateral side of the thigh. So if we kind of shift our view down here, we'll notice this is looking at the lateral aspect of that thigh there. And we have a muscle right here, and this muscle is called the tensor fascia latae. And so this is the final muscle that we're going to concern ourselves with in this video. That muscle highlighted right there is our tensor fascia latae. And we'll notice this nice little band right here that sort of functions as a little bit of a tendon for the tensor fascia latae. This is going to be called your iliotibial band or iliotibial tract, and that's going to be a common area that you may hear people talk about, that they have like IT band pain or IT tract pain, and that's just that sort of long connective tissue structure right there that the tensor fascia latae is going to connect to. And I will actually go ahead and spell out the name here. Tensor fascia latae. I believe I spelled that correct. But that is going to be our tensor fascia latae muscle right there. And so that muscle is, or that is it for this video. That's muscle 61 through 70, and sorry, 51 through 60, and then I will come back with the final video going over muscles 61 through 70. So I'll see you guys then.